morning. My name is George Arthur Sapong. I'm Director of Engineering at Viamo. Viamo is a global information service organization working in connecting audiences around the world or populations around the world that are not typically able to access information. And we do this by providing, content in local languages, and we've been doing this actually for the past 12 years. Funny story, the first time we publicly demoed our capabilities was right here in Accra at the last ICT4D. So it's a sort of a full circle moment. And with Gen AI, what we've been doing work around our existing platforms, which provide information services to millions of people around the world. We've been running pilots in Zambia and in Nigeria, and we've opened it up to a small percentage of our users through a feature we call Ask Viamo Anything. And we've been getting really good engagement, that's pointing to areas of interest in terms of what people want to hear, what they want to understand. And this is with the power of, even without internet, they just call on a regular phone and they're able to ask their questions like, information about maybe education, what kind of courses should I take if I'm interested in doing nursing, and this is stuff that we're delivering over voice. So they're able to hear that information and even follow up with questions. And then we've been going on beyond the general purpose generative AI capability over voice. We're also working with expert areas in something we call Ask an Expert, where we're building features that can allow, maybe a community health worker or an agriculture extension officer, use these tools on domain-specific information to provide guidance to maybe people in the field like farmers or nursing assistants, who are providing advisory services to the populations in remote areas. So that's a summary of what we've been doing, and I'll pass it on to you, Ocean.
Thanks, George, and thanks, Howard. Good morning, everyone. My name is Ocean. I work for an organization called Sahaj, and we are a boutique tech consulting firm operating in data engineering, platform engineering, and AI in general. And within Sahaj, we have something called the Sahaj Impact, through which we partner with organizations like these, mission-driven organizations, and help them appreciate on the data, tech engineering, as well as the AI front. Myself, I lead the data science practice for Sahaj in North America. And we have been working and partnering with these lovely organizations on the panel and otherwise as well to explore how AI can help, and specifically generative AI, can help appreciate the delivery for the targeted population that they are serving. And we've been looking at not only implementations, but also challenges with the implementation that we are doing in the space around caution of response, factual correctness, security, guardrails with respect to accuracy with the response that you intend to do, whether it's through a fine-tuning process of an open source model without using the proprietary solutions out there, or building a retrieval-based pipeline, as George was just mentioning. So there are multiple spaces that we are looking at as part of the Sahaj Impact program, where we see data can be brought in the unstructured format, leveraged to serve the underserved population with the security concerns and the challenges that we are facing. And we are probably doing a lot of research in this space as well to kind of improve further on that. We'll probably discuss more as we proceed forward. Over to you, Kristen.
Thank you so much. Hello, everybody. I'm Kristen Peterson, and I'm the Sprout platform lead. Sprout is the digital agriculture platform that is open and is designed for building skills and capabilities for smallholder farmers across Africa. So we're a project of Mercy Corps AgriFin, and I'm one of the initial people who thought Sprout. So Sprout's vision is that every farmer in Africa should have the tools of information and data that's personalized for them to help them make decisions and take action in their daily lives around farming and going to market. But we all know that doesn't exist. So how are we doing that? Well, Sprout has a model, and our model is that we're building an ecosystem of organizations first organization to have expert content and services around farming and farming adjacent activity. And we're working with farmer-facing organizations who work with farmers and reach farmers at scale. So we're building an ecosystem of almost 150, 30 content service organizations and over 100 plus farmer-facing organizations. We bring them together with our platform and transformation team, where we both do open content, so we take scientific content and turn it into very simplified, farmer-friendly, digital-ready content that farmer-facing organizations can use with their farmers to engage them, upskill them, and build their skills and outcomes. But we also are starting to do data-driven services from service providers, such as weather organizations and over time mechanization, soil, health, and pests. And so we're starting to do that now, and we have essentially worked in about 8 countries, 6 languages. And how are we involved in AI? Well, all of this content has formed a basis for this vetted, it's open, and it's available for anyone who goes to our platform. And we're taking that and we're turning that into the intelligence for farmers and farmer-facing organizations by building a conversational AI-driven platform that will connect via both WhatsApp and in the future USSD and other areas, so that our farmer-facing organizations can connect and engage farmers to get access to this kind of information. So we're also looking forward, where not only we do AI, generative AI, but we work with the service providers who also have generative AI on how to plant in the exact right time in northern Nigeria for your maize farm. And so we're opening up to that as well. So we're really excited to be here. Thank you.
All right, everyone. Welcome to Ghana. My name is Nana Kofi Boakye. I'm the Acting Country Director for Aurum Institute Ghana. Aurum Institute Ghana is an affiliate of the Aurum Institute, which is a health impact organization headquartered in Johannesburg. Historically, our portfolio has been in implementation research and clinical research for TB and HIV, as well as program implementation. More recently, we're branching out into global health security and digital health. What we do with generative AI is building clinical decision support tools. We're working with and for clinicians to make sure that we can build complementary tools that allow them to make better selections of antibiotics. We're doing this because of antimicrobial resistance and how major a problem it is on the continent, and the fact that a lot of it is driven by inappropriate prescribing. And that inappropriate prescribing isn't happening because clinicians don't know that AMR is an issue. It's happening because to make an appropriate prescription, the amount of information that has to be synthesized from medical text or from the patient context can sometimes be mismatched to the time you have in the clinical encounter. So what we're doing is working with a pool of AMR experts, pharmacists, microbiologists, and lab technicians, as well as clinicians, obviously, to build this tool that can be integrated into an EMR so that clinicians can get more direct guidance for making food and antibiotic prescribing choices.
Okay, fantastic. Thank you for the introduction. So we have 2 different groups here, and we have the expert, like Christine and Nana. So my next question is directed to the expert, Christine and Nana. Can you educate us on some of the ways that generative AI can harm populations?
Thank you very much. It's a very important question. For those of you who basically the most vulnerable entrepreneurs in Africa in life, because if they get the wrong information and they make the wrong decision based on that information, they not only can lose their crop, they can lose their family's food, they can contribute to regional food insecurity. And so it's incredibly important that farmers get the right information. And how are we doing that? Well, one, we will only work with vetted, available, scientifically backed information that we're using to build our LLM, and we restrict access and we don't let the chatbot wander beyond its known knowledge base, so that we can ensure that the farmers get the right information for what they need at that point in time. And so that's roughly.
Yeah, I think what we do at Aurum is quite similar in terms of how we make sure that the patient population is protected. as you can imagine, in clinical care, there really is no room for error. So when we look at deploying these tools, we're trying to figure out ways to make sure that we can limit the inherent challenges with the base models. We know that there's a risk of hallucination, and that's why I'm pretty sure all of us are using the retrieval-based pipelines to limit what the answers are based on to a vetted pool of documents that experts would use to make such recommendations. We're also mindful of the fact that even the base models, that when we're making selections around them, they're based on evaluations that are often multiple choice. So Google, for example, would evaluate MedPalm 2 on a QA dataset. That dataset is a question with multiple choice answers and you pick one. That's not how clinical care happens in the real world. It's a complex vignette with a multi-dimensional answer. So we're trying to figure out a way to build and operationalize ethics by design, by making sure that we're considering the risk of harm even in the design phase, looking at what that limits us to in the choices we can make for system architecture, and being very mindful about what it means when we're evaluating the tool. That includes making sure that we have reasonable thresholds about what a correct answer is, reasonable thresholds about what a good match is in terms of the source documents, and we try to make sure that where the tool does not have sufficient context from the documents we have, it does not pretend to have that by creating an answer based on the base model as on assumptions. So these are some of the things that we're working on to make sure that this is a safer tool to deploy.
Thank you. If I get it right, what I'm hearing is it's essential to work with the population that you're targeting so that as you build this technology, they're included in the process. Right? So to the technologists of this panel, when we talk about vulnerable populations, these are necessarily folks that may not have a sophisticated understanding of the technology. Right? So as a result, they may trust too much. How do you build guardrails to ensure that you mitigate some of that harm, misinformation, and abuse?
Sure. Yeah, I think that's the really important part there, which is we trust too much. I was reading an article where the writer said generative AI always hallucinates. Just most of the time it aligns with reality. And so if we're building solutions designed for vulnerable populations, I think Nana's point is fundamental. Starting with that mindset in the development phase, recognizing that inherently that there are biases in such systems. It's also about understanding also what your data sets are. What sources of data are you getting? And in the parts of the world where we're working, especially in development, we don't have a lot of data for those areas. And so we sort of have that responsibility at the back of our mind as we operate. And then we at VM have been working closely with Ocean and team at Sage. We're looking at ways for creating, instituting some guardrails and learning from them. Some of them include, filters, where we can moderate some of that content. Some includes even monitoring, understanding what the users are asking and evaluating, the performance of your own modules. How well do they answer those questions? And at the same time, being transparent in terms of your sources, like where we got this information from, so that we can adequately address the kind of users that would be asking us questions or using our services.
Thanks, George. And just building up on that, right, from a tech standpoint, when we talk about security and guardrails, there are two aspects of building security and guardrails. One is preventive mechanism, and other is more around the monitoring that George was talking about before. So when you talk about preventive mechanisms, it aligns with the fact that when you are analyzing or using moderation on the questions that are asked, validating on the kind of content that you're using to create your LLMs or power your LLMs, or as a matter of fact, doing filtration that George was talking about before. And all of this can be done through building very task-specific, geography-oriented models, natural language processing models that can be beyond LLMs as well. You can use open source models, transformer-based models like BERT, or even GPT-3 to fine-tune and train and understand where the questions asked are within the purview of the expertise that you want to kind of render to the population. So that's on the preventive side of it, where you can analyze it from available APIs like a moderation API from OpenAI, which George and team has been using, and appreciate that with custom trained models in the space. On the evaluation side is how you kind of understand whether the information extraction is happening correctly and aligns with your objective. And with that, there's always, I would never discount the fact that of having a feedback loop in the process where you have a human in evaluation in the initial days so that you can capture that feedback and better your models in terms of fine-tuning and training. But appreciate that with evaluation frameworks today, like we have RAGAs or RAG triads, which are specifically designed and built for, pipelines that are powered by retrieval augmented generation that use LLMs to, utilize knowledge base in a particular domain. And there are other prompt-based and evaluation frameworks, the point that Nona was, earlier pointing out about, having, correct ground truth in the space. You have, and the evaluation frameworks, the benchmarks that are already available might not be 100% reliable with many of the research and many of the implementation that we hear from our panel here, is to kind of appreciate that with, bringing in human expertise to build that ground truth and integrate that in your evaluation frameworks. Custom paired with available source of information, available APIs in both the preventive space as well as the guardrail space is I see the way to kind of address any kind of challenges we are facing when we are leveraging large language models in the space.
Thank you, Oshin. I feel like I always learn so much when any one of you guys talk, so thank you so much. But staying on this topic of trust, right, because it's very important, one thing that we've learned from the many years of ICT, end user will not use a solution that they do not trust. So can you share a little bit about your experience within your organization on how do you build trust with end users? Maybe we'll start with Nana and then we come this way.
Sure. So, like I said, we began this thing with an ethics by design approach. And one of the learnings we had there was the need, as Oshin is saying, for a group of experts who can actually advise on the domain itself. We have a 21-person expert panel of the EMR experts. A subset of 10 of them are the core evaluators. And since the beginning of the project, we've been working with them. We started out by having a dataset development workshop where we walked through the documents that would be used as ground truths. We evaluated them for bias, we evaluated them for utility, we ranked and rated them, and then used those ranking and ratings in actually building the system. We gave feedback about how the functionality of the tool looked and took commentary from, or comments from the expert panel and other healthcare workers around. We don't want a tool that requires us to type in all the information. They want something that's exportable from the EMR into the tool. We want prompts displayed in a certain way. We took all that information to make sure that, as much as possible, not just the question of how it was designed takes their views into consideration, takes their expertise into consideration, but how it was deployed also takes that into consideration. We learned, for example, that clinicians, there had been a study here that looked at how patients respond to seeing a clinician do a manual referral during the guidance, and the response wasn't too good. So the clinicians appreciated the opportunity to participate, but were more keen on the question of how will it look in practical usage. And that was something that we didn't think about when we were starting. So that kind of guidance, that kind of context, that kind of on-the-ground expertise is really critical. And if you don't factor that into how you build, you may have something that is validated as effective, but is not practically useful. And that's something that we've been really making sure we get right.
Really interesting. So I think our model and how we operate by working with farmer-facing organizations, not farmers directly, is really key to trust and adoption. And I think trust and adoption are very important together, because if you have trust, that's great, but if you don't have adoption, then you don't have anything. So trust lies in the human networks in our model. And so what we do is we work with organizations who have a trusted relationship with the farmers. And they oftentimes, with farmer-facing organizations, digital doesn't reach all the way to the farmer. It goes through the farmer-facing organization. It may get out via SMS, but there's also groups. And so there's group leads who are much more savvy and with technology. And then there's and who engage with the farmers in the field. There's a model where their incentives are aligned to help the farmers do better. And the farmers work with them, they make more income, they learn more, whatever it may be. Sometimes it's NGO, oftentimes it's an ag tech who makes a market from their products. But they have to gain the trust of those farmers to build their business or solve their, they're the ones who are responsible for engaging and helping explain and onboard and build that capability for the farmers to use the technology. And just one last thing, we're going to field with our prototype. Thank you. We've been working closely also with Sahaj in the next few months. And so we'll also be starting to leverage our team to test and then engage and get feedback on where those angles, where we can improve, both with our farmer-facing organizations as white label users and the farmers that they're serving. So thank you.
Thanks, Christian. And I will just add to what both of them said, because having experts on the panel, having domain expertise, having field testing kind of adds to the trust aspect when we are building solutions in the space. From a tech point of view, I think bringing in transparency towards the information source while you're providing information kind of adds to some level of trust. However, the challenge associated with that is not all the underserved population is tech savvy enough to, look at the response, go back to the reference, verify and see if, if it's good enough or not. And they probably will, trust it on the face value. Coming back to, what George was saying, that sometimes there's a lot of trust, too much of a trust there, where you work more on the prevention side of these models and these implementations so that you ensure you are having significantly well guardrailed solutions out there with certain level of transparency and feedback. One another thing that, not from a technology standpoint, but working with organizations like Sprout and VMO, what, we have learned is having an association of the solution with probably known organizations who already have ground trust. For example, VMO already have been serving a lot of countries in the space, and that already does some level of trust building exercise in terms of engagement. So when you are trying to bring in some technological capability with respect to transparency, it becomes easy to kind of reach out to the audience. And I think it substantiates with you as well, Christian, when you're talking about field research. So apart from the transparency part that I'm talking about, associating the solution with an organization or a body or an institution that's well trusted around, and specifically again with any of our panel members, for an example, is something that I see is a good way that will work towards building that trust and also add to, I guess, the adoption part that you were talking about, Tristan.
Ocean's given the prelude to how we do this. This is through what we call the VMO platform, or you might have heard it as 3-2-1. So in Ghana, it's with various MNO providers. We're working with MTN on that, but it's been run in Ghana on Vodafone on 3-2-1. And it runs in a number of African countries. And so over the years, we've spent time building those local connections, making it a credible source of information for many users, over 20 million users across Africa. And it's also a service where they can access information about news, about even weather information. We're partnering with news agencies, so they put their content on there as a sort of offline information service. And so as we have built a lot of this, we can leverage on it in providing these new capabilities. But a platform is not alone by itself trustworthy. And that's why we have local staff, like our platform managers, who can work with these sources of information to get, them even transcribed in the right languages. Because, for example, we operate in 6 languages in Ghana, and in every platform country that we operate in, we have multiple languages. Sometimes even just missing context, can create, misinformation in some way or form. And then we also further enhance our platform experience through our user experience staff who survey and engage our audience to understand, so that we could improve overall the benefit people get from it, because that's essentially the way we're able to deliver the services. Yeah.
Thank you, George. So in summary, we've learned about building trust to working with experts, so that brings credibility, building trust to working with proxies and partners that have that embedded trust already to them, and also like working with end users. So we also wanted to try this year, open this up to the audience and see if there is other ways that you guys have tried and used to build trust with end users. Since this is a conference about learnings, right? We want to open it up to see if there's anybody who would like to talk to us about their experience building trust.
Juan Noriega, and I am from Oxfam. So one of the things that we try to do is really open up or taking the technologies as close as possible to the communities and trying to really explain in a simple language what the technology is going to do, and also being transparent with the risks, because we often overlook or we try to sell something that we have created, but we try not to talk too much about what the risk or the cost of the sustainability of the technology. So those are a couple of things. So yeah, and also was wondering if we can talk a little bit more in the panel, like if there are ways to open the technology more to the communities, and in this case, the farmers, like for them to really get to know how it works. That's it. Thank you.
Building trust by opening technologies and making the technology transparent, right? Like when it comes to AI, there's this whole concept of black boxes. So how do we make those open and transparent? Anybody else?
Hello, everyone. My name is Mariam Hina, and I'm from Tanzania. I work with TAI Tanzania. And what we've done is we've taken an app called Oki. It's an app helping girls track their menstrual cycles, but also giving them information on reproductive health. And what we've seen in building trust is that we use the human-centered approach to localize the application for Tanzania. And what that means is that we worked with young girls, the actual users of the application, to collect data from them on what they would want to see on the application in terms of content, but also even the interface and what specifically they would want to see that would attract them to the application, but also make it relevant to them. So that's how we did it, using the human-centered design approach. Thank you.
Like George rightly said, it's a vast space, at the same time a very fast-moving space as well. There's a lot of updates happening every now and then. And I see, apart from the data science space, I also see possibility of more robust data engineering pipeline that's going to be backbones of systems and solutions that, Nona, Kristen, and George are talking about. That kind of brings in the stability, that kind of brings in the transparency, the validity that we are all talking about to the solutions that we are rendering out there. Specifically from the generative AI space, I do see, with the research going on, right away from leveraging the models for solutions like we've heard, what George was just mentioning, but also tied up across the overall value chain, starting from data understanding, normalizing, comprehension, to leveraging, creating knowledge and expert systems out of that, rendering solutions to the last mile user, whether it is information access, whether it is intelligence, whether it is training, whether it is assistance, and finally the monitoring aspect, the KPIs in the space. For example, in the social impact space, there has been field research has always been popular, and field research gives you a good reality check, but tying it back to the rest of the components in the value chain and designing an overall ecosystem where you are leveraging AI wherever it can appreciate the overall pipeline, not for just specific use cases, but across the overall value chain from source to the last mile. So the two spaces that I see here is in the data engineering, more data engineering robust pipelines that can back, the models like we have today. And as we see the research evolving in the LLM space, it needs to be parallel with research in the MLOps space as well, so that we have the capability to back solutions of this massive scale or models of this massive scales, and also solve for rendering challenges, in a less tech-savvy ecosystem and geographies. And of course, the ecosystem part, which is more in general that I see from a tech standpoint, from a data science standpoint, that we can look at or envision AI in each of the components across the value chain, and backtracking it as well as taking it forward from the source to the last mile and monitoring and response. Yes,
Yes, so I'm definitely a technology optimist in general, but I think that the opportunity for AI is quite exponential for this user base. So, I think one of George's points is we used to be push only, and we could do a little, push and get feedback to rural farmers, rural, people getting health care. And what I believe that generative AI is going to do is really unleash the ability for information and data services to reach far into the communities where it never reached before. And not just send, but engage, and truly engage. And how is that going to happen? Well, I think the other important thing that you mentioned is ecosystems. There's so many things happening in generative AI. What we're really excited about at Sprout is, first, generative AI is helping us scrape information and making it available readily to users in a simplified format and digital way that anyone can use. And that's very simple to do. And our team that are of experts monitors that, and we'll be using that more and more. But then as we start to build the capability to have two-way discussions with farmers via white label, there's also the opportunity, so those can scale through many channels, but there's also the opportunity to take that data from those farmers, like their location at the simplest form, and turn that into a service for the farmers. And that service can go out to other AI generative organizations, weather intelligence, soil intelligence, planting intelligence. And so that's why I think it's really exponential, is these ecosystems, not just the technical, but the actual partnership ecosystems can really transform and work together to engage communities for their benefit and user communities. And also, most importantly, get their feedback. So you know if they like it, you don't, and if they don't, fix it and figure out how to way to make the case for them to use it.
I think in the clinical use case, the kind of debate around where this is going is kind of twofold. There's an argument around generative AI as a means to provide clinicians where there are no clinicians. And there's a question about whether this is meant to be a tool to complement the efforts of existing clinicians. At Aurum, we fall on the complement side of that debate. We see this as an opportunity to really improve the quality of care by better basing practice in evidence and making sure that that evidence is usable at the fingertips and that it's provided in a way that's contextualized to the patient in front of you. That opportunity makes it so that clinicians can not only provide better care, but it has also knock-on effects for the cost of the health system. AMR, the domain we work in, is a very costly area, and not just in financial costs, but also in lives, considering that in some countries in Africa, the resistance rates are high enough that for some infections, there's just not good antibiotics. So we see this as an opportunity to really make sure that we're enhancing the quality of care provision. That said, we're also mindful of the fact, like Oisin said, that these pipelines or these ML ops approaches do have to improve so that we can make sure that we're able to deliver more robust solutions. But even as they improve, still there's a need to have expertise in the domain integrated in through humans in the loop, reinforcement-based feedback learning. Those things are all critical to make sure we can get this done. Again, similar to what you're saying, Kristen, also the question of the ecosystem. This creates an opportunity for us to pool together clinicians who really understand or see the value in evidence-based practice, to give them a practical way to turn what are sometimes facility-based or unit-based stewardship programs or quality assurance programs into things that can be translated into nationally usable tools. And it creates really a really good vehicle for turning these kind of small learnings into operationalized, practical, usable tools that make it so that what we learn at the small scale can really rapidly be scaled up for utility across the country. Thank you.
Thank you. As we wrap up, one thing I like to do, one thing that excites me with AI is when I talk to different people, I always hear about some amazing new application that I had never thought about before. This morning, for instance, I learned about a local company called Zipline that uses drone to deliver medication or different things. I'd never heard about them before. So I can't wait to go back to the hotel and Google them up and then see if I can meet them. But to the panel, can you tell us a little bit about, and it's like very quick, we don't have a lot of time, what are some exciting opportunities that you see to use the AI in Africa? And you can't talk about the stuff that you guys are already working on. So no agriculture for most of you and no healthcare for you, Nana. What are some other exciting use cases do you see for GAI on the African continent?
Well, there is an opportunity in the policy space as well. There are lots of the guidelines, not just in health, but in environment and practice for technology and so many other areas are based on information synthesis. The ability to do this for most governments can be quite challenging because it's costly to convene these groups and have these long meetings and conferences for data set review and all the kind of systematic analysis that's required to go into that. There is an opportunity in policy to really look at how some of this Gen AI can help with synthesizing gaps and understanding how to better identify resource needs that provide that fill in those guidance gaps. That's something that we're actually discussing with a couple of ministries currently, and something that I do think is a really promising potential there.
It's amazing. And I think that there's a few people from the government here, so I'm sure they can hear you.
Sure, I'll jump in. So I think one of the really interesting things with generative AI that is it can solve huge problems if it's done in the right way. And so one of the biggest issues that we have, but I think we have in the farming, the agriculture sector, but I think it's also in the finance sector, it's in so many sectors, is where do people live, how much land do they own, and how do you connect that to data that can be used as a decision-making tool for policy. So I'll give you an example. Where are people living? What's their GPS coordinate? How much land do they have? And is that land, can you connect that to a financing mechanism? Most of the organizations I know, they go to the field and they have to go and collect data physically. If there can be a way to take generative AI and using satellite and combination of number of different tools, how can we collect data that can be beneficial and make services, whether it's a government service or a private service, more effective for the end user? Whether it's finance or it's inputs, deciding how much input to put in a farm by the government. How do we take that and accelerate availability of data for making good decisions for populations?
Thank you, Christine. It's really fast, George. We don't have a lot of time, so it's really fast.
I think the potential really is also on representation. Right, languages and history and education. I think it neatly ties in together. One is, for a long time, African languages were written by other people. But this is a chance for us to work on creating our representation. A lot of our history. My grandmother would tell me our history of how people migrated, but then it's often lost, it's often passed down in oral tradition. But this is a chance for us to neatly tie in the opportunity to represent our cultures, our history, our language, through the possibilities that generative AI has. I think over the lunch I was talking with Data Science Nigeria on some amazing work they're doing in that space.
Just to add to what Kristen was saying, probably an extension of what she was mentioning. So there is also data gaps. The extensive comprehension capability of large language models allows you to standardize and normalize data from various sources. So when she's talking about collecting data, it also requires some level of standardization to be utilized significantly well in any of the applications that we have been discussing so far. So the comprehension capability and the multimodal capabilities that we are looking at today, whether it is from text to images to speech, from structured and unstructured content, and the capability to extrapolate the data as well wherever there is a gap. It's something, this I see as an opportunity where the data might not be as transparently or as well structured or is available simplistically. There's a significant data gap that can come in, and you can leverage generative AI to not only standardize that, but also extrapolate that to fill that gap from historical information. And of course, just adding to what Kristen was saying, make the data, holistic for it to be used in any of the applications that we have been discussing so far.
Thank you so much. George, Ashin, Christine, and Nana on a fantastic panel. Thank you so much.